Welcome on in to the Health Elevated podcast. I'm your host, Dr. Rylan Fowers, and in this episode, we had a fantastic conversation between myself, Dr. David Hedges, our co host, and Dr. Tim Fowles about AI and discerning truth and error in the realm of healthcare in our modern age. There's a lot of misinformation out there in the healthcare space, and how do you know what's real and what's not? Let's take a listen. One thing we were talking about earlier is this idea of living in a world full of misinformation. And Tim, what you were sharing was a really good example. And I kind of wanted you to share that where you were saying, like, hey, if you're trying to build furniture from an online tutorial and it has some mistakes in there, that's a lot less detrimental than if you get some information concerning your health. So, what were you saying about that, Tim?
Yeah, we live in this world of amazing access to information of any kind. If I'm, fixing my plumbing, or if I'm growing a garden or learning an instrument, or almost anything is got amazing information at our fingertips. Not all of it is true, but the risks of misinformation are different depending on the context. So, like I said, if you're building a do it yourself furniture project, the risk of getting the wrong information for building your table or chair is pretty low. It might turn out weird, but that's about it. On the other hand, if you're getting information about your health or healthcare, that could be really dangerous and could even lead to serious medical complications. So the costs of misinformation are different depending on the context.
All right. So, that raises the question. How big is this concern of misinformation in the domain of healthcare? There's a lot of stuff on the internet, and definitely we have AI that might be impacting that. But the question is it for better or for worse? So, what do you think the extent of the problem is when it comes to healthcare?
The age of AI is changing so fast that it's hard to keep up because what I rely on, and I know both of you as scientists also look to the research literature, that literature doesn't keep up as quickly with changes in AI. But some recent figures suggest that people are turning to AI more and more frequently for questions and answers about their healthcare. And AI can be a great resource if used properly, but it can also be a source of information, just like everything on the internet.
So, just want to throw something out. The age of AI, you'd say we're in this age of AI. But prior to this, and perhaps a natural step towards the age of AI, was that we were in the information age. We were swamped with so much information through the internet and through other media that we couldn't keep up as it was. So I know prior to generative AI being released, as I'm trying to keep up with current literature in the fields that I care about, I can't do it. I couldn't do it. There were dozens of papers being released every day through disparate fields. There was no way that I could keep up with the direct literature related to the problems that I'm working on, as not to mention even just getting to peripherally related research to start to enable a cross pollination of ideas. There is absolutely no way that I could keep up with the just torrent of information coming at me. And so I almost feel like AI can be a very powerful tool for basically processing that information and then guiding me towards what's most relevant to the problems that I'm trying to find so I don't have to manually sift through the potentially hundreds of papers a week that could have relevant insights to the work that I'm doing today. So I think there's a two-edged sword.
And the one downside potentially is that in addition to so many papers just coming out over and over, and there's just so much research out there, there's also a lot of bad information that's been growing arguably at the same rate. And I think maybe a lot of these AI models are trained off of Reddit, famously, or other sources like Wikipedia that are not they're not going to get sued for using proprietary information that way in some instances. And I know there's like some growing areas of research where people are trying to train a large language model only based off of published peer-reviewed research. But even then, not all papers are created equal, right? And so for the everyday person, there still is this huge battle of misinformation out there. And I think one question someone might have who's listening to this would be like, how do we know that there actually is bad information out there? If they're questioning that at all, because I think you turn on any social media feed and you'll probably find something that seems a little fishy. But we've actually seen, and relating this back to AI, I don't know if you guys have heard of these like horror stories of people taking like ChatGPT's medical advice and it ends up causing them detrimental health effects. I've seen like a few news stories, and maybe that's misinformation. I was thinking like I didn't evaluate it properly to know like how real these stories are. Maybe it's just people who are afraid of AI promoting these stories. But I have definitely seen things, I guess, as a based on some of the stuff I know and study, things that go against reality that are being promoted as if they're facts. Tim, do you have anything to add to that? Do you see any like evidence and proof that this misinformation in healthcare should be of concern, like where it's actually causing problems?
I think misinformation in healthcare has been around a long time, a lot longer than AI and a lot longer than the internet. If you go back to the era of patent medicine and snake oils and things like that, you could argue there was even more misinformation back then. But what we have now that didn't exist back then is we have a platform for anyone and everyone to post their ideas. There's this democratization of information, which is in a lot of ways a good thing, but it puts the onus of responsibility to discern what is truth on the end user. And this may be what you're getting at. Your listeners may be wondering, okay, there's so much information about my health out there. How do I know what's truth? How do I figure out what's truth and discern between correct versus incorrect information?
Yeah, totally. I'm actually going to ask that question to David now because as a trained professional, what do you do, David? In you talked about there's just so much information out there, but is there any tools or stuff that you use to kind of discern between what is accurate and true and what is just false information?
Yeah. So I actually have a mental questionnaire that I go through. I think the first thing I always ask myself is, does the writer of this article or blurb or whatever it is, does that person stand to benefit if I believe them or if I believe this article? So, are they selling something? Are they trying to gain a following? And if there's ever the possibility that they benefit if I believe it, I question it. And that's step one. Generally, if someone's trying to sell something, almost automatically that's a disqualification for me. I know that's a bad way to look at it, but that's just my experience and what I've seen. And if I really want to know if something's true or not, you look at, are they trying to sell me something? Are they benefiting in some way? And is this information corroborated anywhere else? So is it, and particularly, I'm very picky about the source. So one thing that was just heavily drilled into me through my professional training is look at the source. Is this, and try to take the claims back to primary source research if possible. Secondary research is also can be valuable, but primary research is really that's the standard. If you can somehow trace a claim back to the primary research and then go in, and if you have access to the primary research to actually evaluate it, that can be it to me that has been a way to really show what's going on. And so I'll give an example of this. So I that's the way, a rough way to put it. I love running and I want to be a better runner. I'm a terrible runner, but I want to be better, at least on some level. And for a while, a lot of social media, a lot of quick fix running says the best way to be a better runner, to be faster, is to improve your VO2 max. And the best way to do this is this particular interval style workout. Some people call it the Norwegian 4x4, some people call it other stuff, but this is the best way. And I said this is proven in literature. But if you trace it back through all these articles, through all these kind of just consumption articles, all the way back to the original paper that looked at the workout, they evaluated a couple different workouts against each other. And one of them, if you look at the figure, that particular interval workout had the highest impact on VO2 max, but there was another workout protocol right there that was not statistically different from the first one. So Functionally, they're the same. And so an evaluation of the real research gives a completely different view than was in popular running articles. And so just things like that where it's not necessarily misinformation, but it's misleading information. And I think just being able to reconcile that process and go back to the original research if possible is one of the most valuable things. The problem is it takes time. So you really have to make sure you want to do this for things you care about, but it takes quite a bit of time to sift through what's true and what's not true.
Yeah, I've been sent so many sensational articles from news media about some kind of health thing or health related topic, and I have to look at the article, read what they're saying, and get very skeptical about some of the claims that are being made, find out where they're linking the research to that supposedly supports what they're saying. And then from that research article, I can look at that and then review what this article is pointed to, what limitations it has, other articles that are in that same vein that do or do not support the same thing that this particular article pointed out. And it actually takes a lot of work just to find the sources to uncover the truth because it's masked behind sensational YouTuber who is citing some sensational news story, who is citing a particular article that seems to support a certain narrative. I'm wondering, Tim, from your perspective, is there anything you personally do that to try and understand truth and misinformation within the healthcare space? And then I want to kind of get into what individuals can do who are listening to the podcast. But yeah, Tim, any thoughts?
I can tell you what I strive to do, but I can't claim to do it perfectly. And that's because I'm a human and humans have built-in biases. But I think David makes a great point about consider the motivations of the source of truth. But I also try to consider my own motivations, which is hard to do, but matters a lot. One of the things that we've learned in the past few decades of cognitive science and for which Danny Kahneman won the Nobel Prize is that humans have these built-in cognitive strategies which can sometimes predictably lead to errors in judgment and reasoning. But the bottom line is, as humans, we have our own biases, and those play into the way we try to discern truth. We're drawn to things that match our pre-existing beliefs, that we're also more likely to believe things that get repeated over and over, regardless of their actual truth. We have a tendency to take shortcuts in our thinking because that's the only way really you can process the massive amount of information that we're presented with. Our brains are set up to create these heuristics and these shortcuts, which serve us well in a lot of situations, but can mislead us in the wrong kind of situation. And if you want, I'll give you a famous example from Tversky and Kahneman's research. Do you know about the baseball and the ball cost paradigm? Is that come across any of your
I
work?
I'm not familiar with it.
Yeah, me either.
It's a way that Amos Tversky and Danny Kahneman researched these human kind of shortcuts. And what they did was they did this simple arithmetic paradigm. They say a bat and a ball cost a dollar cent 10 total. The bat costs a dollar more than the ball. How much does the ball cost? And if you ask people this, they take a mental shortcut, which is you divide things into dollars and cents. So they immediately say the bat costs a dollar and the ball costs 10 cents. But if that were true, then the total would not be a dollar 10 than the ball. That would mean the bat costs a dollar 10 and the total would be a dollar 20. In reality, the correct answer is the bat costs a dollar 5. And so that was just one of literally hundreds and hundreds of examples of the way people take these mental shortcuts and get misled. When you're talking about the cost of a toy bat and a ball, it's not that serious. But when you're talking about taking mental shortcuts to decide which medication to take or to decide about a disease condition you may be worried about, then you could be in big trouble.
Yeah, totally. We've mentioned some of the ways that we try to discern between good information, bad information. But the question is like, how can someone like a family member of mine be better equipped to understand what is correct when she's scrolling through social media or sees her friends on Facebook sharing some information? What tools can she use? I don't think of a specific family member. What tools can she use to better discern between what's good and what's bad, knowing that she might not know how to dig through and read research articles. She might not have the train of like how to evaluate research papers, for example. So, Tim, what do you think about like this, putting this in practice for kind of an everyday use case?
Okay, great question. I would start with what we talked about earlier, intellectual humility. Start with the idea that I don't know, I don't have all the answers, and I may be misled if I'm not careful. That's going to prompt you to use what Kahneman calls system two, or your more deliberative thinking system. And then you start to do the kinds of things that David was mentioning. Okay, where is this information coming from? What's the motivations of the person who's promoting this? Do they just want to get clicks on social media? Or is this some reputable body that has a different goal, like the American Academy of Pediatrics or something like that? Is this backed in any kind of rigorous science? And that's hard for the average person to know, but it's easy to consult someone. I'm guessing most of your audience, if they're not scientists themselves, they know people who are scientifically trained. Even your primary care physician has a significant amount of scientific training and can be a source of information about your health. And but you have to have that humility in order to ask an expert.
So, David, you're a data scientist. How do you think Dr. Gemini PhD plays into this? If someone, suppose someone doesn't know a scientist, do you think AI can actually help out and act as the scientist, or do you think that actually makes the problem worse, given that these AIs are trained on a large body of information, some of which might not reflect reality, and all of the potential generative nature of AI that could make it hallucinate or even say things that aren't correct? So, yeah, what are your thoughts, David?
So, my hard feelings about the use of AI is that since AI is trained on anything, everything, it can spit back anything and it has all sorts of spurious correlations. Those are the hallucinations you're mentioning. It can say all sorts of weird things. And if you're not in a place where you're able to refute that, then you're not using AI properly. And to say this in another way, I think that your personal knowledge, skills, and ability should be the hard boundaries for your usage of AI. I don't think that using AI as a search engine is an appropriate use because it can return all sorts of weird things. You should always be able to read through the AI results and verify them based on your own knowledge and skills. If you go outside of that, there's a risk of AI slop, there's a risk of misinformation, there's a risk of just consuming total garbage. So, if you are using AI in an unregulated capacity to diagnose yourself, diagnose someone else, or to come up with your own treatment plan, I don't think that is a good use of a now there's going to be a whole risk spectrum, of course. If you're asking a or a recipe to come up with a recipe based on the ingredients you have, there's low risk. You might have a terrible dinner, but that in the grand scheme of things, that's low risk. You might have an amazing dinner, so that's also a possibility. But if you're asking for something that's going to translate to some long lasting impact, then I think that's a problem.
Jim, any thoughts on AI?
Yeah, I totally agree. It's a tremendous tool, like we were talking about earlier, for digesting and synthesizing massive amounts of information, but it's dependent on asking the right questions. My scientific training was much more about learning to ask the right questions in the right way than about just memorizing lots of information. And I think the same is true for the way you use AI. You have to ask it the right question, and you have to be able to discern what's potentially wrong about its answers. And then you have to have experts on board. It helped if I gave a real world example. So I was talking to a cardiologist the other day who says all the time he gets people in the office who have high LDL. That's the bad cholesterol, leads to coronary artery disease. And so he'll tell his patients, look, this is a potentially problem, could lead to heart disease and stroke, and we can control it really well with statins. I'm going to prescribe this medication for you. And they'll say, no, I want to do this with diet and exercise. I've read that's the key. And that's true. There's definitely some truth in the fact that diet and exercise play a role in, but coming from his expertise, he could see that's not going to get you as far as you need to. But instead of arguing with the patients, he'll say, he knows this is a long game. So he'll say, hey, why don't we do a little experiment? Why don't you get on the diet that you've read about? As long as it's not dangerous, then I think it's worth a try. And we'll just see how your LDL changes over the course of 1 or 2 months. And then they get to see firsthand by doing this personal experiment. And 99% of the time, they aren't able to reduce their LDL enough to reduce their coronary artery disease. That's the whole reason why he was suggesting this medication in the first place. But it does give them some kind of sense of agency in the whole matter, if that makes sense.
I love that example. That sounds like a good, smart position because ultimately, individuals' health is in their own hands, right? And they have a bunch of tools, including AI, to help them try and navigate the healthcare and the healthcare system. And at the end of the day, it is their decisions. And I think that's like one of the main takeaways I'm getting from our conversation here is like you have to have a healthy level of skepticism when approaching health information. And you can't just take everything as like automatic 100% truth without understanding nuances, whether that comes from social media or AI. And good doctors, I think, are going to do things like what you just described, Tim, where they'll work with the patient to help them come to the realization of what's best for their health, as opposed to just demanding that they live a certain way or something. Because unfortunately, but for better for worse, humans tend to be a bit rebellious when they're told they have to do something if they're not coming to that conclusion on their own. And so I think that applies to a lot of the stuff we're saying here.
Thing for me, perhaps, Rylan, I think that it's really important to say that the age of information and the age of AI and the availability of information does not replace the need for experts in our society. We still need those experts because when we receive information in some way, it is absolutely exhausting if we have to go fact check and source check everything that we read. It's really hard for us to know, and we really need to have the expert availability and the expert voice so that we can have someone else whose job it is to help vet that information and to be able to rely on that. And I think, Tim, you hinted at this, it's important to rely on your primary care physician to help process that. Primary care physician is an expert. They are able to process that information. They're able to better recognize and understand what truth is. And I think a lot of this is we can't just consume everything through social media. We can't consume everything through YouTube stars or whatever we're getting our information from. It's very important to have trustworthy sources of information and to rely on them so that we don't have to, because it's just too exhausting and not sustainable if we have to go back through and source check every single thing in every conversation, in every interaction. I think it's important to avoid sources of slop and to really gravitate towards true sources of information, whether that's your primary care physician for health information, whether that's trusted journals for information, or however. I think we need to be very vigilant about where we're getting our information from so that we don't have to just source check everything.
Or any kind of technical tool can be used really well, but it cannot replace the effort we have to put into making our own decisions. And that may mean consulting an expert. In the example that David gave about running, it meant going to the original source. That kind of effort is key to discerning truth. The other thing I might say, and this is putting on my psychologist hat, is that A, not replace genuine human relationships. AI is really good at something that humans are not good at. It can take a massive amount of information and synthesize it in ways that humans could never do, but it can't provide the kind of closeness and intimacy and social reward and reinforcement and support. And that is essential to our lives and our health as human beings.
Thank you for listening to this episode of the Health Elevated podcast. We hope you enjoyed it. If you did, please give us a review, 5 stars, or a thumbs up, and consider subscribing for more content in the healthcare space.